Hello friends, welcome back to my channel. Well, today I am going to discuss with you regarding the action verbs in OET speaking. Well, mainly action verbs is used to start the conversation in OET role play, and it is also useful to elaborate in a proper communication and proper flow. It is very important area in OET speaking. Some of you may know and some might not know. Okay, so well guys, today I will tell you in proper manner that what is action verbs and what all are included. Okay, so first, action verbs, it denotes the action you, like you means candidate, needs to demonstrate in the role play using appropriate language. सो जब हम ओएटी का स्पीकिंग करते हैं तो जो एक्शन वर्ब्स होते हैं तो वो मेनली जैसे एक्सप्लेन हो गया, फाइंड आउट हो गया, तो मीन्स जो एक्शन हमने करना है, एलेबोरेट करना है टास्क को कैंडिडेट ने, तो उसको बोलते हैं एक्शन वर्ब. सो फंक्शनल फ्रेजेस कैन बी यूज टू एलेबोरेट द गिवन एक्शन वर्ब. तो हम फंक्शनल फ्रेजेस जो है वो यूज करते हैं to elaborate action verbs, and these functional phrases can help you to have a proper beginning to each task. और हर टास्क के लिए जब हम हर टास्क को शुरू करते हैं तो ये हम फंक्शनल फ्रेजेस जब यूज करते हैं तो इससे एलेबोरेशन में इजी हो जाता है और जो टास्क है वो प्रॉपरली एक्सप्लेन किया जाता है. मोर ओवर विद द हेल्प ऑफ एक्शन वर्ब, smooth beginning can also be there, and it will also help to candidate how to start the task. So well, first, in first category or in first set, the action verbs are: first is find out, then ask, then explore, then collect, gather. So these all are the action verbs, and I have made this in first category because the action of these action verbs are same. In this verbs, mainly we can gather the information from the patient. Okay, so the main functional phrases we can use are: first one is I would like to know more about your condition. So in this mainly we can collect the history of the patient, regarding his disease condition, regarding his family history. Okay, so next is if you don't mind, may I ask, means we can take the permission of the patient and ask the question from him or her so that we can get a clear picture of the patient condition. Okay, so next is could you please elaborate, and next is could you please tell me. So in this mainly we can just collect or gather the information from the patient. And moreover we can also use these verbs as a synonym also. So if, we can also say I would like to ask more questions from you. Okay, so I would like to know or I would like to gather more about your condition. So like this you can also use it as a synonyms. Okay, so next is second category or second set, like explain, tell, inform, outline, elaborate, or discuss. So in this, mainly explain means we are giving the education to the patient or passing some information or providing some knowledge to the patient. So mainly these verbs are used as an education or explanation type. Okay, so the main functional phrases we are used like this: I will tell you everything in detail. So sometime the patient asks the nurse some questions. So we can start, as a nurse, we can start our conversation with the functional phrase, and these functional phrases like this: I will tell you everything in detail. I would like to explain the procedure to you. Don't worry, I will take you through the different treatment options. If you don't mind, I would like to discuss the importance of कुछ भी हो सकता है like disease of the patient, like sign and symptom of the patient, like treatment of the patient. So we can use these types of phrases. Again, we can use like these also as a synonyms. So if in your task there is explain, we can also use as I will inform you everything in detail. If tell is there, we can use another synonyms outline, elaborate, or discuss. So, well, these can also be used as a synonyms. Okay, these verbs. Next is the third category. So, in third category, uh, like verbs are emphasize, reinforce, stress, and underline. So, mainly, stress means importance of something. In this वो हम पेशेंट को बताते हैं कुछ इम्पोर्टेंट किसी चीज का, और कुछ चीजें ऐसी होती है जो हमें उनको अवॉइड करने के लिए भी बताना होता। तो दैट इज द एम्फेसिस और री और स्ट्रेस और अंडरलाइन। सो द मेन फंक्शनल phrases we can use as let's look at the importance of doing exercises every day. So it's a different synonym because most of the student use I would like to tell you the importance of like, but it's a different phrase we can use in OET speaking. The next is it is significant to take medication on time. Then next is please ensure that you follow the instruction given by the doctor. Means we can stress the patient but in a polite manner. Then next is please keep in mind. So these are the phrases we can use when we focusing or providing the importance to the patient. Okay. Next is the fifth category or fifth set. In this, the verbs are persuade or convince. Means we can mainly try to motivate the patient so that he or she can do what the nurse can or doctor can suggest him or her. Okay. So first phrase is given your condition you need to take rest for at least 3 months. And another is it can be difficult for you initially. However, you will be able to notice the improvement in your health gradually. So in this case, we more focus more on the motivation part. Okay. So in a clinical part also, when we are taking care of patient in hospital, most of the time when we are motivating the patient, if they are not in mood, but after motivation, they are used to do what the nurse can encourage the patient and force the patient to do, so the patients are convinced at that time. Okay. So the next is fifth category and it is also a fifth set, like console or encourage. The phrases, functional phrases are I do understand how difficult the situation is for you. Please relax, we will take good care of you. Next is I can only imagine how stressful it must be for you. So see here we can provide empathy to the patient. So empathy can be direct or indirect. So like direct empathy is when we are facing the problem in our past and we are providing we are telling the patient that in at the place of you when we are there, I also experienced the same problem. So with this the patient can be feel relaxed. Okay. So another is the indirect empathy, that a nurse can't has not faced that problem, but he or she just providing the empathy to the patient. Okay. So it's a console or encourage. Next is the sixth set. It's a reassurance. So reassurance is a very important in OET speaking, as even a single role play can be completed. Okay. So it's a main verb used in OET speaking. So the phrase are, I reassure you that slight changes in your routine can bring a great improvement in your condition. Okay. So last is seventh category or seventh set is resist. Resist means कि when we restrict some thing to the patient, and it's a very difficult part when we are refusing the patient that we are not the person to do your help. Okay, so the main phrases or the functional phrases we are using in this part is, I am afraid I am not the right person to comment on that. I am sorry, it's beyond my scope of practice. So sometimes patient ask that what's our condition and what's our diagnosis, but as a nurse we are not the right person to explain the patient. So we can use these types of phrases. Okay, I am sorry, it's hard to time frame of your recovery because it varies from person to person. You may please discuss it with your doctor while he is here for his rounds. Okay, so these are the phrases when we use when these are the phrases when we use in the restriction time. Okay, so today we are discussed action verbs. So first is find out, ask, explore, collect, gather. Then explain, tell, inform, outline, elaborate, discuss. Next is emphasize, reinforce, stress, underline. Then is pursuit, convince, console, encourage, and reassurance and resist. Okay, so these are all the verbs. It's, I think it 20 to 21. So please use these verbs in your speaking to to achieve a high score in your OET speaking. Thank you for watching my video. Thanks once again.